So I was asked to deliver a session tonight on brain fog, but I've deliberately put it in apostrophes because I think a bit like fatigue, it can often be minimized, brain fog, just from the get-go. There can be a thing, it's just me, or, it's kind of, it's up there with kind of baby brain for anybody that's had babies, it's this kind of, anyway, we'll not talk about it. So brain fog is the title, but hopefully as we go on, we can see that it's has a lot more impact and seriousness than perhaps just the label that it's often given kind of by medics as well as ourselves. So, some of the aims then I thought we could cover today, just looking at some of the causes and the effects of brain fog and breaking brain, well, we would call it kind of cognitive difficulties or cognitive impairment or cognitive challenges. So forgive me if I switch between the two. So cognition, just for anybody who doesn't know, just means your thinking, your thought process. So that can often be the more kind of medical term. You'll start to, if you Google anything, Google cognitive impairment and aplastic anemia, that would be your kind of go-to. So I'll break it down into the three main areas of attention, memory, and executive functioning. And then I'll look through some tips and techniques that you can take away and hopefully put into practice as a way to kind of help, one, improve it, but also kind of manage and accommodate some of the changes that you'll have noticed and experienced. And then you can ask any questions that you have at the end. So thinking a little bit about the causes and effects. So this is a really new area of research, especially in relation to aplastic anemia. There's a bit more being written about it in cancer, which coming from Maggie's, I work with cancer patients. And even within that, it's still quite a new area. So we don't really know for fully what the causes are. We think that there are probably a lot of different factors and a combination of factors at play. So this could be stress conditions, lifestyle choices, workplace problems, but there will also be physical causes and psychological causes that will contribute to this. So some of the physical causes will just be the aplastic anemia itself. There's research to show that anemia can have an effect on cognitive functioning. So our processes of day-to-day thinking, memory, paying attention. And some of the treatments that you may have had, a note for each of you, you will have all had different treatments. It was not just one size fits all. So some people, and this is why the next slide is kind of important that I come to, because the effects of these treatments will be the same for cancer patients. So I've drawn on a really interesting slide that I hope will reassure you. But the treatments itself can certainly have an impact on your cognitive functioning and the side effects of these treatments. These might be some hormone treatments for people. Some people maybe have to go through an early menopause. There will be electrolyte changes and some of the immunosuppression drugs that you have. There are things called like cytokines and things which are kind of inflammatory processes that happen. And these as well can lead to cognitive impairment as well. So this is the slide that hopefully you'll all kind of relax. So I will name it. This is twins who have had treatment for a breast cancer, but I'm more coming at it from the angle that the treatments that they've had will be similar to treatments that you may have had. But also we use this for people who don't have a breast cancer diagnosis. So for everybody who's had a cancer treatment, but I think it just really captures the impact that treatments can have on the brain and therefore cognitive functioning. So this is what we call an fMRI, so a functional MRI study. So that just shows the movement and the activity and the flow of the blood in the brain. So there were two twins, and whenever us psychologists get identical twins, we're always really pleased if we can put them through some different tests, because that is the gold standard. We know that genetics are not at play here because they've both got the same thing. So what they did was twin on the top, so twin A, she had a curative breast cancer diagnosis for which she had surgery followed by chemotherapy, and her twin did not. So what they did was they got these twins and they put them through a barrage of what we would call cognitive assessment. So things that assess their memory, concentration, decision-making, spatial awareness. And they did this while they were in this fMRI machine. So poor them. But what we can show is that And it's really important at this point to acknowledge that they showed no, what we would class in the kind of scores, no cognitive impairment that we would worry about. So they scored within the normal ranges, and there was very little difference between them. And that difference may have always been there from birth if we'd have done this prior to their treatments. But what we can see from the twin A, the twin on the top here, is look how much more brain activity. So anything that's red or yellow, white, that's the hot spots. So the twin A, she is having to use a lot more brain power while she's going through these assessments compared to the twin who's not had a chemotherapy treatment. So when you maybe are saying to yourself, is it just me? No, it's not just you. Here is some cold hard evidence that shows that similar treatments that you will have had for aplastic anemia can have an effect on your brain. So although she scored within the normal range, what she reported was it was almost like she was having to work harder. She was having to put so much more effort in than she did prior to her treatment. This study backs that up. So if you're feeling that you're having to put a lot more brain power or effort into doing tasks, if it feels like it's kind of thinking through treacle or cotton wool, this is because this is true. You're actually having to use more brain power than you did before you had any treatments. So again, I hope this reassures you that this is a real lived experience. However, what we do want to kind of acknowledge is that this doesn't mean impaired functioning. So we'll come back to that though at the same time, but this is often when people go, oh, so it's not just all in my mind. It's absolutely not just all in your mind. This shows us that people who've had treatment are absolutely having to use more brain power. Now, I have this on a Google alert to see if they ever have followed these twins up. To date, I don't think they have. It may just be that they're both living their lives quite happily and have declined to do it, or maybe they didn't get funding. So we don't really know if this improves yet for them. I hope so. But if it ever comes, we can let you know, or we can do an updated version of this. So thinking about the psychological causes, so other factors that come into play when you've had a diagnosis of aplastic anemia and the upheaval, it causes a lot of psychological upheaval and changes. So there's depression, stress, worry, anxiety, anger, fear, sleep difficulties, fatigue as well, all have an impact on cognitive functioning as well, and that experience of brain fog. And it can have such a big effect on your day-to-day life and your quality of life. So people tell us that it has an effect on their memory. So they forget dates, numbers, names of people they've maybe known for 20 years. They bump into them in the street and they're in the middle of a conversation and thinking, I can't for the life of me think what your name is. And you get all nervous and flustered. There's a lot of the tip of the tongue phenomenon, which we'll come on to. So I kind of, that sense that you know the name's in there, I just can't quite get it out. The mental fogginess, so that's that kind of treacle brain, cotton wool brain, can't concentrate. You maybe read the same page over and over in a book, or picking up and reading a book feels impossible. Following a TV show, it's maybe, when did that character come in? Who was that? And you're maybe having to ask your significant other a lot more about who that person is in the movie. And then you think, oh, that causes a bit of, I'll just not bother watching it. There can be confusion. Again, difficulty finding the right words, following conversations. People say even following conversations in a busy environment. Multitasking, we will come on to this, and learning new skills. So there's so many different effects that it has on your quality of life, your confidence, your self-esteem, your relationships with your family and friends. And then certainly people worry about the impact that it'll have on their ability to work effectively in employment. So I hope that captures some of what your experience has been. But then what can happen is there's this vicious circle that happens between the physical causes and the psychological causes. So you might be somewhere, you bump into someone and you then you can't remember their name. So, and that's because of all the physical causes that we've mentioned. That then leads to increased stress and worry and anxiety, which has the physical effect of increasing your stress hormones, in particular cortisol, which then affects the memory part of your brain. which then means it's all the harder to remember that person's name. So you get even more stressed, your cortisol goes up, the hippocampus is affected in your brain, and so on and so forth. So we want to try and break this cycle a little bit as much as we can and come at it from different areas. So managing the physical causes and the psychological causes and their effects. But before we move on, one of the key things is brain fog or cognitive impairment doesn't necessarily mean reduced functioning. So if we were to put you through this barrage of cognitive assessment like the identical twins had been through, you would likely score within the normal range. Now, yeah, that's when people kind of go, oh, well, you know, Debbie, but well, that's all very well, but it will mean that you have to use more of your brain and more brain power in order to score that, but it does mean that you would still be within the normal range. What I will say is caveat that is if you're ever worried, really, truly go and get it checked out by your GP. 9 times out of 10, it comes back fine. But if you are worried that something more sinister is going on, get it checked out. So with that, it's the speed at which you do things is kind of increased and that process is interrupted. You're still able to do what you used to do. However, it takes longer. It feels harder to carry them out and recall information and concentrate. But please take home, it doesn't mean that you are cognitively impaired. If you're worried, get it checked out. So thinking about how we manage it and breaking it down into the 3 areas, we always start with attention. Attention is the first part when it comes to cognitive functioning. So attention just means to focus on, to concentrate. So whenever we're talking about attention, we have this idea that maybe before attention, or just in general, that attention is this unlimited resource that we can pay attention to everything and anything. So a bit like me today, your attention will go in and out depending on how tired you are, how long this kind of goes on for. It's not an unlimited resource. So we always encourage people to think about their attention like a bucket. You only have so much space in this bucket. However, when you have a diagnosis of aplastic anemia, you now have aplastic anemia in this bucket. The treatment of aplastic anemia, pain, stress, medication is taking up space that it wasn't necessarily taken up before. So what we need to do is try and allow for this space that's been taken up that wasn't used up before, and perhaps taking some things out that we don't need. So this idea of, you know, you can think about the spinning plates. What plate can I maybe take off? What can I do to keep on top of what's in my bucket with regards to attention? It's not unlimited. It's also important to think about the different kinds of attention. So we can break it down into sustained attention, which is what will probably be happening, I hope so, today when you're listening to me talk about brain fog. So it's also what is when you're having a conversation with someone, it's following that, watching a movie, reading a book. These are all examples of sustained attention. Then we have selective attention. So if you're listening to me today, but then your door goes, or you've got somebody kind of coming to, you're hearing your family in the background, that would be, you'd be in and out of maybe listening. Is everybody okay? Do I need to attend to what's going out there? They come back to listen to me, Debbie, talking about this. Maybe even chatting at a party. You're trying to do this, but there's a lot of background noise. Then another one is alternating attention. So following a recipe, having to turn the temperature up, moving down the steps. And then there's what we would call divided attention, multitasking. Again, we'll come on to this, but it's important to think about perhaps the different kinds of attention, just because it might be that you notice that perhaps it's one more than the other that you're having an issue with, which means you can be a little bit more selective in the interventions or techniques you use. But these are certainly, if you're wondering if you have a problem with attention, these are some of the things that people tend to say to us. I can't focus on watching TV, lose the thread of a conversation. And that might even be when you're talking, you're maybe talking away in the conversation and you're kind of like, I'm not quite sure where I was going with this point. You put things down, forget where you've left them, become distracted in the middle of what you're doing. So if any of these things are ringing true, then we would say this is perhaps a difficulty with attention that you've got. So what we would say in order to help with this, we could perhaps practice paying attention. So that might be doing something that you enjoy. So perhaps trying to read a book, but I'll come on to how we can do this effectively. A lot of this will be similar to the techniques that we perhaps used in the fatigue workshop as well. So if you're practicing them, then this is just adapting it for this. You might want to take a class, playing computer games and apps, puzzles, any of your crafts, hobbies. Mindfulness and meditation is a great one for paying attention, because that really is just the skill of bringing your mind back over and over again. And there is some research that's coming out now, particularly with relation to people who've had different treatments, that by practicing paying attention, it can help improve these difficulties that people have. But how do we do that effectively? It's the same as when we did the fatigue workshop: frequency, duration, and intensity. So we want to say start with frequency first. So say you were going to be, right, I'm going to practice my attention by reading a book. Then we would say build up the frequency first. So you're just going to read, I want to be able to read every day. So practice reading every day, maybe for 5 minutes or 2 or 3 pages. And once you're able to do that effectively, then we would say, okay, build up the duration. So you could maybe I'll do a chapter, I'll do 15 minutes, I'll do 20 minutes. Okay, I'm now reading for my half an hour every day. Then you can think about intensity. So suppose that would be in relation to this, perhaps your more gripping drama of a book, or your more kind of like detective, where you're really having to hold a lot of information in mind. So start with perhaps an easy book, a book you've maybe read that you're familiar with, or some of these more trashy, easy reads that we have that we maybe read on holiday, rather than a more kind of gripping sleuth book. And that would be how you would increase intensity. So frequency, duration, and intensity when it comes to practicing and paying attention as well. But then we also want to think about ways to kind of compensate for this kind of reduced attention that you might have. So because the bucket is now a bit fuller than it used to be, so we want to limit as many other distractions as we could. So things like hunger, pain, anxiety, stress, these all take up space in the bucket. If you're going to be doing something kind of that's going to require a lot of attention, so it might be filling in forms or different things, then turning off external distractions. And I often laugh because this is something that I have done for years without even realizing. I don't know if anybody's the same as me, that when you're looking for, particularly in the hospital, a car parking space, you turn the radio down, and it's just because there's, again, that limited amount of attention. But that's just something that I've always done, and I never really knew until looking into this. That's perhaps why, is it's just allowing that attention to focus on finding that space, paying attention to what's going on round about. We would say try and manage your fatigue, which hopefully you're finding ways to do that, pacing yourself. And say, often another one that people kind of say is, like, I'm always going into the supermarket and I keep coming out with the one thing that I meant to go into. And that might be because there's a lot of distractions. People kind of leave their trolleys, stop in front of you, the music's going, you've maybe struggled. So maybe go into some of these places to begin with until you build it back up. Going at quieter times when there's less distractions, or a lot of the supermarkets are having quiet hours as well. So, you can make use of these times as well, until we can practice and build it back up. So the reason we go on to memory after attention is because in order to remember something first, we have to pay attention to it. So that's why attention comes before memory. So what is memory? We just kind of say, I used to be great at remembering things, but actually there's a lot more to it. There are so many different stages when it comes to memory, and attention is the first one. We have to pay attention. And I think that a lot of people maybe kind of think that they had this fantastic memory before, and that may be true, but often we're maybe just a lot more attuned to some of these difficulties. And again, memory isn't an infinite resource. It's similar to attention. So people often come and say to me at this point, but what about people with like eidetic memories, or who can remember all these things? Or I've read about these people who can remember everything. And that's what we would call an issue called hyperthymesia. And that comes with a lot of other problems. So that we would say would be a kind of a problem people have to seek support from. So it's not in fantasy, it's a great idea, but it does come with other challenges as well, this ability to remember everything. Oops. So these are the 3 stages of memory. And again, we break it down into this because you might notice that perhaps it's one particular stage that you are struggling with rather than some of the other ones. So the first part of memory is paying attention. So as we've gone through attention, you might have been thinking, oh yeah, I think that is me a little bit. I think I'm struggling with my attention. So we have to pay attention to it, kind of almost putting it on our mental blackboard or putting it on a file and writing it down in the right order. We have to be like, if you're listening to me, paying attention, and as you would be maybe scribbling it down, hoping you're getting the information in the right order, you're getting right what I'm saying, different in accents as well. And then we have to kind of encode that. So that means kind of almost putting it in a filing cabinet. A few things can go wrong at this point. So if you think of yourself or your brain as part in memory is like a PA, so she's got the file and she has to now take it to the filing cabinet to put it in long-term memory. But she's a bit slightly overworked. She's got a kind of boss, which is maybe our kind of internal thought process going, I can't believe that's taken you so long. Why are you not paying attention? Do it faster, do it better. While you're doing that, I need you to do this other thing. Don't forget to get that when you're at the shops for me. So that can go there. You finally get to the filing cabinet and then you have to put it in the right file, in the right drawer, in the right file, and hope when you need it that's in the right place. And again, after a bit of time, there'll be files in front of it, there'll be files after it. And then when we need that bit of information, we need to be able to go back to the filing cabinet, find it in the right file and take it out and make use of it. And again, at that point, the PA might be going, oh my goodness, I don't think I can remember where I put that. I'm going to embarrass myself so much in front of my friends, my boss, harassed getting there, and then maybe can't find it and is struggling. So, and then maybe finally she gets the information that's needed and can make use of it, but she's flustered at that point and is maybe her confidence is affected. So these are the different areas that it can go wrong with, but it also means there's the different areas that we can get it right. So if we know paying attention, then we can, manage our buckets. That means the information in the file's right. If we reduce our stress, then we're more able to take it into the filing cabinet, and the same with getting it out. So these are some of the things that people say. If you notice you're saying any of these things about, have I got a memory problem? It's remembering what people have told me in conversations. You maybe think, oh, or you're saying things and your partner might be saying, I just told you that 2 days ago. Why are you asking me again? Or can you not remember that? And then you start to kind of get that embarrassed feeling, or you start to think, oh, maybe I'm daft, maybe something's going on there. You forget people you've known for decades, losing things, forgetting to take medication. That can be one, or then forgetting to take it, but then also forgetting if you have taken it or not is something that people then struggle with as well. And I can't see the one behind, so I'm sorry about that. So we want to help thinking about how we can improve memory. So again, breaking it down into kind of external strategies. So this is maybe when you need to make use of good old-fashioned notebooks, lists and notes and calendars, using phone apps, voice recorders. If you've got like a whiteboard or a chalkboard, putting it up in your kitchen. And it might be that's when some of this kind of pre and post comparison to come in, but I never needed to use it before. But you didn't have to use extra brain power before. That is the effective treatment. So anything we can do to kind of make things easier, then less brain power is needed as well. Putting everything where it's meant to be. So your wallets, keys, you know, making sure you do put them in the dish on the hall table rather than having to find them, really trying to get into a routine for these different things. And what we would hope is that it does start to improve, that you don't need to do it as much. But then some of the issues that people say is, but it's remembering to check the list, remembering to check the diary, remembering to check. So setting alarms and reminders can be really helpful. Using the Dorset boxes for any medication. And sometimes tying these in with something. So maybe having breakfast, you know, so that it becomes linked to different things. The other thing when people say, I can't remember if I've taken the medication, is if you've got a glass and your medication, when you've taken it with your glass of water, turn the glass upside down when you're done with it. And that way, when you go back and it's upside down, you know you've taken it or not. So just wee things that you can try to help with that. Some of the internal strategies that you can use. So often we find for a lot of people is that visual images are much easier to remember than words. So say you struggle to remember it, just these examples is your shopping list, then often it can be helpful to practice, like, so thinking of your shopping list while you're walking around your supermarket. So we always tend to go to the same supermarket, don't we? And then you know the rows, so picture yourself doing that, or you can picture yourself going round about your house. You trip over some tea bags on your way into the hall, and then there's a big carton of milk that you have to climb over on your way up the stairs. So kind of almost creating like a little journey to help you remember it. And as I say, making associations between things. So taking medication with meals, leaving keys by the door, pictures with a name. So I Googled before we came in. So my name's Debbie, and it can be quite good to, I do it when I'm doing my memory and concentration. So somebody, one of my colleagues, when we were doing it, she would say she's Louise, and she's Louise with knees. So we would think of that. So I'm Debbie, and you can, so that for me, because my full name means is the Hebrew for bee. So you can think of Debbie. That's how you can remember. So, and you don't need to be doing this out loud. This is just when you're maybe in your own mind to help you remember that. The other thing you can do is if you're struggling with name recall, so somebody you've known for 20 years, as you go through, you could do the alphabet. So doing it almost in like kind of primary school. That's, you know, when you're little, you would go A, B, K, D, O, D, Debbie. That, you know, so using the alphabet as a prompt to try and help some of these recall issues. Often when people are struggling with word finding, it can be hit. So say you were struggling to think of the word hospital, thinking of the word nurse, doctor, white coat roundabout, it can often be a way to kind of prime the word that you're looking for as well. But we'll come on to stress as well as a way to kind of another important factor when it comes to helping to find these words as well. So I put this in because somebody gave me in a group that I was doing, I will own it, it wasn't me, it wasn't one of my psychology colleagues, it was somebody who was taking part in a group that we did. And he was kind of saying, so people wonder if memory can improve. So you think of London black cab drivers, they have to go through training for the knowledge, and that is a massive, massive amount of training. And what they did was there was a study, and it was over the course of 4 years. And again, they put these black cab drivers in an MRI machine at the start of their training and at the end of their 4-year training. And they looked at the part of the brain called the hippocampus, which is the memory center effectively of the brain. And what they showed was that compared to those people who had passed the knowledge, so kept with the study, and compared to those that they didn't, their hippocampus had grown massively compared to when they learned. So we absolutely can work to improve our memory. It tends to be that they think that it kind of causes new connections between neurons in the brain. There might be more kind of building up round about it. So we can absolutely work to improve. If we practice different memory skills, then we can improve memory. But again, we need to do it with this frequency, duration, and intensity. So if you're starting any of these kind of brain training apps, starting with the easiest one and building up the frequency, then the length of time, and then increasing the difficulty. That's same with everything: frequency, duration, and intensity. So we come on to then executive functioning. So this is the kind of multitasking part, if we think about it that way. So it's kind of putting everything together. And it is one of the most complex aspects of our cognitive processing. So we can almost think of it as the CEO or the conductor of our brain. So it's in charge of planning, organizing, adapting, prioritizing, and decision making. And the part of the brain that's responsible for that is the frontal lobe, so this bit right here. And if we think back to that brain scan, that was where a lot of the brain power was, that was where all the hot spots were. It was at this frontal lobe of the brain. So it makes sense if we're kind of thinking decision making and everything is much harder than it used to be. Sometimes what do you want for dinner becomes the hardest question in the world to answer. So if we're having so much more effort going in, and all these things make sense. So if you're thinking again, it is real, it's not just in your mind, it is difficulty, but we can work to kind of manage it. So a really classic example of an executive functioning task is making a meal. So these are the different steps to kind of executive functioning or a multitasking task. First of all, you need to be motivated and you need to make the decision to do it. You need to then plan, get all the right ingredients, think about the time that you want to start making, get everything out and cut it. So then you do all the prep, and as you get everything on the hob, you then have to kind of watch everything. Oh, the pasta's about to boil. Oh, turn that down. You need to time everything right. So the chicken maybe needed to be in half an hour earlier in the oven. So there's a lot of different complex things that go on here. You need to adapt, be flexible. And then this idea of multitasking, we maybe think, oh, we'll just do some laundry while we're there, or we'll answer a phone call, or we'll do whatever. I would tend to say this is the moment where things really boil over, or something goes boom in the microwave, or the garlic bread gets burnt. But who knew there was so much that had to go on in this brain just to make a meal with so many complex tasks. So again, some of the questions that you might be, in order to kind of see if you have a problem with what we would call executive functioning, is if you're kind of finding it hard to kind of monitor your progress or complete things on time. If you're having a discussion, kind of drawing on experiences that maybe happened to you, or getting confused when you're making plans. So somebody's maybe saying, do you want to go? And you're thinking, have I got anything on? What time would be good for you? Well, I don't know what time my trains would be. All these things would maybe suggest an issue with executive functioning. However, often what people come in and they say is, I used to be a great multitasker. It is a myth that we are not made to be multitaskers. Humans as a species are not great multitaskers. So there have been a lot of studies carried out on multitasking, and what it shows is that when our brain has to switch back and forward between tasks, especially when it comes to challenging tasks, we actually become much less efficient and we make so many more mistakes. And so this would be the prime example of why it is now law that we don't use our phones when we drive. And they've done a study where they asked, when people were driving, they asked them to complete a lot of different like other activities while they were doing that. The driving became abysmal and the tasks, they didn't do well on either. So this idea of us being multitaskers, as much as we'd like to tell ourselves we're not good at it, what we're maybe do is more just shifting our attention and then coming back. But again, there's no evidence to support multitasking. And I suppose a good example is surgeons and doctors. They really don't multitask. What they have become skilled through many years of practice in is just following a lot of different like sequential steps. And they're good at having flexible thinking, but then what they do is they then just go through the next steps in order to deal with a complication as it arises. And that has taken a lot of tasks with minimizing distractions as well. And as much as, especially as ladies, especially maybe like to think we're good at multitaskers, there's no difference between the sexes. And if it is minimal. So again, if you're thinking, I used to be a great multitasker, the evidence would suggest you weren't. So it's just, how do you manage these kind of executive functioning tasks that you're maybe doing now? And that would be when we would think about really that bucket when it comes to attention, and how do we help the kind of effective storing of information into memory, and trying to reduce some of the distractions that come with it. So please, if you're thinking about multitasking, it is a bit of a myth. There's a lot of research to show that. So how do we help? Again, it comes down to some of the practical strategies. So being really methodical. I mean, the bake-off has just finished, and you always see them, not just in the kind of technical challenges when they get their minimal instructions, but each one of them comes with their list and they check it off as they go through, and everybody on it. So we need to be a bit like that as well. So in a recipe, I'm a dreadful cook. I really need a recipe. So, you know, going back to these old-fashioned recipe books, checking them off. Please know that it's okay to rely on tools. Please make use of them. And we'll come on to this, why it's important with regards to stress as well, but use your organizers, make use of your smartphones, your alarms, your prompts. And sometimes if you're struggling with kind of following, I just like paying attention to a set of instructions, ask people to email them to you. Or sometimes, I know we're using an example of driving, if you're on hands-free, can you phone me back? Can you text me that information? That would be great. So ask for these written down as possible. Find a time to check things that are really handy. So make again a routine of, maybe I check every morning what I've got planned for that week. I'll look at my week long in my calendar as well. Perhaps use a more visual diary. I mean, if you've got an Apple phone, it only comes up with a dot on it. So I've had to change my calendar. I can see visually what's going along it. Just I can't deal with the dots. Keep notepads to hand as well. Write things down. You know, if something comes to mind, you think I can't forget that, write it down. Then you don't need to worry about it. So please make use of these tools. Manage your time and space, you know, so check them, breaking tasks down into smaller, more manageable chunks, decluttering if possible, reduce distractions. All of these things will help with these cognitive processes, and they might seem trivial, but everything adds up, small gains. So we want to come at it from as many different angles and get as many different benefits that we can. So, and what we do know is that this is the M8 in Glasgow. It's the busy motorway. There are roadworks everywhere. They've been here for about a year. So to begin with, all these tips and techniques that we'll go through will feel really effortful. But it's a bit like when you come to, if you'll have had it, a motorway's got roadworks and you have to find an alternative route. To begin with, it's a bit stressful. You have to get used to it, but you do get used to it after a while. Same with all these techniques. You will get used to this detour that your brain, it's your neural pathways, you're having to make another one, but this will become well worn as well. So you will get used to it, and the cells that fire together wire together. So if you keep going down, it just becomes as natural as the other one as well. So again, this is a bit of a repetition of some of the other things. Check off steps, use diaries, but the other one is there are some good apps out there as well. So this one, I think I've spelled it right, is Freezer, and it's an app that keeps track of what's in your freezer. So you can use that. It tells you what's there step by step and what drawer. So we always lose track of what's in those weird bags that we find 4 years later. There's one called Brain Dump that somebody was telling me about, and you can just put it in your brain and then it'll ping every now and then to tell you. But again, you have to kind of be mindful to go back and check these things, and using your reminders on your apps. There are so many apps out there to help with these as well, these difficulties. I think it's really important that you allow yourself a little bit of leeway and to be flexible and go back to different tasks and not to rush. There is a lot of research that shows that rather than this kind of continuous focusing, so trying to sit down and do a task in 3 hours, we're much more effective if we do smaller bite-sized chunks, 20 minutes. Give yourself plenty of time, more time than maybe you need, but you're thinking of how much more harder your brain's having to work. And if we allow that bit of extra time, it can make it easier to manage. Make sure whenever you're doing these things, you've got all your aids as necessary. So hearing aids, so you're not having to kind of listen. That takes up space in the bucket. Glasses, squinting, taking up space in the bucket. All these things will be helpful as well. The other things, again, is eating healthy. Carbohydrates and sugar, these are the only things that power the brain. So that for a while they were often seen as the enemy, but really making sure that we get everything that we need to power the brain. Aerobic exercise, if done from this fatigue management standpoint, gets the heart pumping, it increases the blood flow and supply and oxygen to the brain, which will help with these things. Rest and sleep, and I said meditate and relaxation. So I think I had this idea that it was about clearing your mind of all thought. That's not true. Whenever you're doing it, your mind will wander, but you bring it back. That is only going to be good for attention and concentration and memory. It also reduces that stress hormone cortisol, which we know affects the part of the brain responsible for memory as well, which is the hippocampus. Manage this vicious cycle that happens. So what often happens is we have these thoughts, I'm embarrassing myself, I'm never going to do that, I'm so flustered, God, I'm making a fool of myself. We feel more stressed, anxious, embarrassed. So we just start to avoid these situations and we can't find the right word. And then because we're feeling stressed and anxious, we have an increase in cortisol, affects our memory centers. We feel flustered, we feel whatever, so I'm making a fool of myself. So we get more stressed and so on and so forth. This vicious circle goes on. Whereas if we can kind of maybe start to say, well, no, I understand I'm going to need a bit more time with that, or I'll employ some of these strategies, or I'll just ask for it in written format, we're less stressed. Our cortisol goes down, that part of the brain isn't affected as much, so we get the word out much easier. So if we come at it from the different angles, we can really make a difference when it comes to these cognitive difficulties that you might be experiencing. Ask for help and celebrate any successes that you have. So when we've done it, people have come in and they've gone, oh yeah, so I managed that task, and I've done, give yourself credit for it. You would give it to other people, why not yourself? So please take note of these things as well, and write down the progress as well that you're noticing, because often we think about where we've got to go or what we're not at, but maybe take a note of where you think you're at today and come back to it in a few months and see if there's any difference with it. So this is the thing with it being such a new area of research. So a lot of this, because of the physical causes, there might be inflammatory processes. So this was kind of done because a lot of people were coming to us post-treatment, noticing these changes and thought it was in their mind. What I can say from my experience is when people we do a 5-week course on this, people certainly report a big improvement in their memory and concentration. And what we would say is that might be a natural, because of the improvement as they come out of their treatment and everything kind of starts to resolve, but it's much more aided if you use these strategies as well. That tends to be a much faster process. Yeah, and again, it is such a kind of new area of research, and I suppose it also means that perhaps it's not been talked about for a long time, which means that, and please don't think I'm being minimizing and saying this, but it means nobody offers anybody interventions. I think that's why I was keen to say that for such a long time, it's kind of talked about as, oh, just a bit of treatment brain, just a bit of chemo brain, just a bit of transplant brain. And it's just kind of dismissed, and so no research was really done to see whether any of these techniques or interventions could be in any way helpful for managing some of these things. So I would encourage to try some of the things, and let us know. And if you are struggling, is there somewhere for more perhaps one-to-one individual support that you could go to get help with it? So I think if it, I don't know of any resources specifically for teens, but I think anything that you can do to kind of be aware of what's in their bucket, especially if they're maybe studying, you know, minimizing external distractions, encouraging regular breaks, thinking about making use of these resources. Hopefully there would be a whiz at some of these apps and things as well. There's a lot of studying apps that might be helpful, and especially those frequent breaks. So anything that you could do to help that attention bucket at school as well. I think there's a wee bit of research showing that perhaps not asking kids to do their homework immediately after school, because those attention centres have been so switched on. That's often why kids go a wee bit, after school. So allowing that time to just, you know, have a wee bit and then maybe coming back to attention can be quite helpful. And yeah, hopefully a lot of these strategies as well with memory. But I don't know specifically resources for teens, but I would say that any of these strategies, particularly minimizing distractions for paying attention, would be really helpful.